This is an important agenda item for the National Governors Association. NGA created a group called the State Alliance for E-Health that is chaired by Governor Bredesen of Tennessee and myself. We've had a number of meetings over the past year. We're focused on ways to design health information exchanges to provide more technological answers to our healthcare challenges. We have adopted a few recommendations already. It's an ongoing process to get some consistency in application and definitions and technology all across the country, and I think we can make some real progress. And I want to emphasize why this is important, why we're talking about a greater commitment to health information technology. It's really about patient safety, it's about saving money, and it's about the quality of care for the people of America who rely on healthcare professionals and who need care at affordable costs. Our Department of Health and Human Services has reported that the adoption of health IT could cut healthcare costs by 30%. Most of all, it's claimed that health IT might save literally thousands of lives every year. Now, how might it save these lives? Well, in today's antiquated paper-based medical record system, healthcare providers need to struggle to make sure that they have their patients' latest, accurate, and fully complete medical records. Too often they don't. Inaccurate information contributes to an estimated 98,000 deaths that occur each year because of medical errors. Doctors demand the best information about a patient's medical history, about his or her allergies, about recent test results and possible adverse drug reactions, but unfortunately they're often forced to rely on notes and the fallible memory of their patients. Pharmacists also have to rely on prescriptions that are illegible. Or consider this: researchers need unprecedented amounts of data about how diseases progress, how treatments work, about how different demographic groups are saved and served. Health IT can deliver these data. Health IT will provide physicians and researchers with better data about disease, easier communication and information exchange among experts, and greatly improved access by physicians to the latest research and medical trial data. And every time a patient or his or her family members must retell a medical history to a new provider, they're responsible for remembering and prioritizing medical information. But with Health IT, doctors will have that information, pharmacists will have the right prescriptions, and patients won't feel like we're suddenly attending medical school. Well, here's another thing that every parent in America will applaud. With Health IT, parents will no longer have to visit a doctor's office to get vaccination and other records for their kids' schools and summer camps. Well, like Iowa and West Virginia, Vermont hasn't waited for Washington to act. We've set up a unique nonprofit public-private partnership. It's called VITAL, Vermont Information Technology Leaders, to bring together payers, practitioners, hospitals, vendors, and state agencies. One result of this partnership is the Vermont Health Information Technology Plan. It provides strategies for developing the Health Information Exchange Network in our state. There are two pilots underway now, one an electronic medication history service, the other providing comprehensive data services for our Department of Health's Blueprint for Health initiative. VITAL is also providing assistance and resources to practitioners who want to use electronic health records in their practices. Our vision is that the Vermont Health Information Exchange Network will share real-time clinical information among healthcare providers across the state. We'll improve patient outcomes, we'll reduce service duplication, and decrease the rate of growth for healthcare spending. We're doing these things in our states, but it won't be enough if Washington, D.C. sits this one out. It's no secret that the people of America are hungry to see positive results coming from both parties in our nation's capital. In terms of both politics and policy, Health IT is low-hanging fruit. With a minimum of effort, Congress can realize a maximum of result. There are few things it could do that would be this easy, and that would be this popular with the American people. There are too many lives and too many scarce dollars at stake for Congress to delay any longer. The time to act is now.